The way diagnostic medicine is practiced in the real world is really quite different to how it's taught in medical school, and this may make a lot of sense for people with chronic conditions, especially those that went undiagnosed for many years. So in medical school, we get taught to pattern recognize. If somebody has joint instability, hypermobility, and is very frequently tired, then we should suspect Ehlers-Danlos syndrome. In the real world, we have presentation clusters. If someone presents with a short-term cough, then the most likely thing is an upper respiratory tract infection. If they've got upper abdominal pain, then it's reflux. If they've got a skin rash, then it's eczema or a fungal infection. And yes, we can tell signs that will direct us one way or the other, but common is common until it's not. So let's say you've got Ehlers-Danlos, you're also more likely to have something called mast cell activation syndrome, which can present with rashes. Rather than this getting pattern recognized off the bat, it's much more likely to get put into one of these presentation clusters. The diagnostic commonalities like eczema or fungal infection many times, or the bowel symptoms to be dismissed as IBS for many years before somebody actually digs deep and figures out, okay, there is an underlying unifying cause here. And what happens is that when people with these symptoms try and go to a doctor and say, these are all of the different things that I've got, can you put them together? The doctor says, I'm overwhelmed, that's way too much, we can't deal with all of that straight away. And look, I understand why that happens. I certainly have missed some of these chronic conditions myself. No doctor is perfect. However, I can understand why this would be frustrating, very frustrating for patients. And it just shows us as doctors that we really need to be sharp to keep an eye out for that diagnostic black sheep. As a patient, what's been your experience of this?